Constipation may be a problem during pregnancy due to proximity of the rectum and uterus. The rectum is located at question ଦେଇଛି constipation pregnancy time ରେ ଗୋଟେ problem ହେଇପାରେ normally କଣ ପାଇଁ due to the proximity of the rectum and uterus ତ rectum ଟା ଆମର କୋଉ ଜାଗାରେ present ଅଛି ତ ମୋଟାମୋଟି ଭାବରେ ଏଥିରେ question ଦେଇଛି rectum is located in rectum କୋଉ ଜାଗାରେ locate ହେଇକି ଅଛି ଠିକ ଅଛି ତ यार आंसर हबो ऑप्शन बी at the back of the uterus normally rectum ର location ପଚାରିଛି ତ rectum ର location ହଉଛି at the back of the uterus ମାନେ uterus ର ପଛ ଭାଗରେ rectum present ଅଛି identify the changes occur to the uterus during pregnant state ତ ଗୋଟେ changes identify କର to the uterus during pregnant state ତ pregnancy ସମୟରେ uterus ର ଯେକୌଣସି ଗୋଟେ changes check କର ତ hypertrophy and hyperplasia of blood vessel hypertrophy means increased size of the cell and hyperplasia is increased number of cell stretching of muscle fiber means stretching of muscle fiber the stretch hobo hypertrophy of lymphatic system then the all of the above means all total ठीक अछि then vaginal pH during pregnancy तो vaginal pH कोन pregnancy time रे आंसर होची acidic ठीक अछि नॉर्मली vaginal रो pH टा हमर 6.5 to 7 भीतर रहे त vaginal pH टा होची acidic the normal vaginal pH during child bearing period आंसर होची 4.5 तो vaginal pH टा child bearing time रे हमर normally vaginal pH केते ना आंसर होची 4.5 तो vaginal pregnancy time रे normally हमर Dodolin bacilli bacteria टा देखा जाए ठीक अछि the vaginal pH varies the range between vaginal pH टा केते range भितरे vary करे यार आंसर होची 4 to 5 changes occur to cervix during pregnancy तो pregnancy समय रे कोन changes हुए cervix रे आंसर होची all of the above केमती कोन चेंज हुए देखिबा pregnancy समय रे normally softening of the cervix टा soft हे जाय hypertrophy and hyperplasia of elastic connective tissue hypertrophy में कहथिले increase in size of the cell and hyperplasia is the increased number of cell तो कनेक्टिव टिश्यू रे हाइपरट्रोफी और हाइपरप्लासिया देखा जाए इंक्रीज भास्कुलारिटी माने नॉर्मली बॉडी रे जेतेबेले हेमोडायनामिक स्टेट रो इंक्रीज हुए तो ताको हम कहूछु भास्कुलारिटी तो ब्लड रो अमाउंट बा आरबीसी रो अमाउंट इंक्रीज हुए जोटा को कि हम कहूछु इंक्रीज भास्कुलारिटी आंसर होची ऑल ऑफ द एबव ठीक अछि then axillary tall Montgomery's tubercles occur during the time of pregnancy because of the changes in the axillary tail Montgomery's tubercles during the time of the pregnancy because the changes in answer hochi breast then colosma will appear on dash body part colosma body ro ko body part रे देखा जाए तो आंसर होची cheeks and bone normally cheeks और bone रे हमरा colosma देखा जाए the mask of pregnancy technically called melasma or colasma appear when step rise in estrogen level stimulate excess melanin production also known as hyperpigmentation then our next question को correct statement regarding changes occurring in the alimentary system during pregnancy तो pregnancy समय रे body रो alimentary system रे कौन change हुए alimentary system हम normal को करबो digestive system रे कौन change हुए तो आंसर अब all of the above increased reflux esophagitis रे हमरो reflex action ଦେଖାଯିବ, muscle tone and motility will decrease, bodyର muscle tone ଆଉ bodyର motility ବି decrease ହବ, then risk of for peptic ulcer reduces, peptic ulcer ର risk ବି reduce ହବ। Next question, correct statement regarding changes occurring in the respiratory system during pregnancy। ତ pregnancy ସମୟରେ କଣ changes ହୁଏ ଆମର respiratory system ରେ, ଠିକ ଅଛି। आंसर हबो ऑप्शन डी, all of the above। Subcostal angle decreases, subcostal angle decrease हबो, chest circumference increases, chest circumference increase होगा, increase in tidal volume भी increase होगा। Incorrect statement regarding changes which occur during pregnancy is rare। तो या भितर को चेंजेस देखा जाए प्रेगनेंसी रे जोटा कि इनकरेक्ट। तो ब्लड वॉल्यूम विल इंक्रीज, हाँ ये करेक्ट, कारण आम पढ़ी जे भास्कुलारिटी इंक्रीज हम। आरबीसी मास इंक्रीजेस टू 20 to 30%, आरबीसी रो अमाउंट इंक्रीज हम, ये भी ठीक अच्छे। सेरम एल्बुमिन लेवल विल इंक्रीज, तो यार आंसर टिके भूल हम, सेरम एल्बुमिन लेवल इंक्रीज करेनि। कार्डियक आउटपुट इंक्रीज, सेटा भी ठीक हम, जेहेतु बॉडी रे हेमोग्लोबिन अमाउंट बढ़ुचे, बॉडी रे आरबीसी रो अमाउंट बढ़ुचे। आंसर होची फिजियोलॉजिकल चेंजेस अकर ड्यूरिंग प्रेगनेंसी इनक्लूड, प्रेगनेंसी टाइम रे हमरा कोन फिजियोलॉजिकल चेंजेस हुए, एटा होची आंसर। इंक्रीज ब्लड वॉल्यूम इंक्रीज होबो, इंक्रीज आरबीसी मास टू 20 to 30%, आरबीसी रो मास इंक्रीज होबो 20 to 30% जाए। डिक्रीज्ड एल्बुमिन लेवल डिक्रीज होबो, इंक्रीज हार्ट रेट एंड स्ट्रोक वॉल्यूम लीड टू इंक्रीज्ड कार्डियक आउटपुट। प्लाज्मा रेनिन लेवल राइज एंड atrial natriuretic peptide levels tends to fall। तो plasma renin level increase होबो and atrial natriuretic peptide level fall होबो। Increased glomerular filtration by about 50%, glomerular filtration rate जोटा कि हमरो glomerulus रे हुए किडनी पार्ट रे तार अमाउंट इंक्रीज होबो 50%। Increased urine frequency, urine रे frequency increase होबो। Hyperpigmentation of the face known as melasma, face रे जदि hyperpigmentation हैला melasma होगा। नॉर्मली आपरो ब्रेस्ट प्रेगनेंसी टाइम रे तीन प्रकार स्किन चेंजेस हुए, गोटे होचे melasma, गोटे होचे हमरो melasma, आ गोटे होची linea nigra, आ गोटे रहबो हमरो स्ट्रिए ग्राविडेरम, ठीक अछि। तो मेलास्मा कौन, ग्राविडेरम। तो मेलास्मा कंडीशन कौन, मेलास्मा कंडीशन होची स्किन रे जते बेला ब्लैक पिगमेंटेशन होबा ताको हम कहबा मेलास्मा। लिनिया निग्रा होची टोटल अम्बिलिकस पार्ट रे जते गोटे स्ट्रेट गारा पड़ जिवो ताको हम कहू लिनिया निग्रा। स्ट्रिया ग्राविडम होची अम्बिलिकस पाख पार्ट रे हमर स्ट्रेच मार्क होबो जोटा कि हम कहू स्ट्रिया ग्राविडम, ठीक अछि। तो हम करले then linea nigra, a hyperpigmented line running down the center of the abdomen may also occur, ठीक है। What is the total weight gain occurring during the course of singleton pregnancy, गोटे singleton pregnancy रे what is the total weight gain occurring during the course of singleton pregnancy, so answer होची 10 to 12 kg। तो total pregnancy time रे हमर weight gain 10 रो 12 kg जाए हेथे। Expected weight gain during the singleton of pregnancy is 11 kg, नॉर्मली गोटे singleton pregnancy रे हमर 11 kg weight gain होथे, in which जो 1 kg in first trimester and 5 kg in its second and third third trimester. ଯୋଉଥିରେ କି 1 kg ଆମର weight gain ହେଇଥାଏ first trimester ରେ and then 5 kg ଆମର ହେଇଥାଏ second and third trimester ରେ। ଠିକ ଅଛି। Which of the following complaint reported by a 32-week of pregnant woman is considered crucial? The answer is frontal and recurring headache. Sodium and water retention occurring during pregnancy because of pregnancy time रे ଆମର sodium ଆଉ water retention कौन ପାଇଁ ହେଇଥାଏ? ऑप्शन होची increased ADH, ADH माने antidiuretic hormone, increased aldosterone, increased estrogen and progesterone. Answer ହେବ all of the above. ADH होची ଆମର antidiuretic hormone. antidiuretic hormone कौन ना ଆମର diuretic माने होची diuresis condition जोथिरे कि excess amount रो fluid body ରୁ release out हब। तो antidiuretic hormone माने से तार reverse काम करबो माने जो excess amount रो fluid ଆମ body ରୁ excrete out होउथला तो से कौन करबो से fluid को inhibit କରିଦବ excrete out ରୁ। तो कौन हबो body रे हमर fluid ର amount बढ़िबो। Then increased aldosterone. Increased aldosterone ର କାମ କଣ ନା ସେ ବଡିରେ sodium retention କରେ। ତ sodium ର କାମ କଣ ସେ water କୁ bind କରିକି ରଖେ। ତ ସେଥିପାଇଁ aldosterone ବଢିବା ଦ୍ୱାରା ଆମ ବଡିରେ water retention ହେଇକି ରହିବ। Increased estrogen ଆଉ progesterone এটা hormonal imbalance ସବୁ ହେଇପାରିବ। ଆଉ ଆମେ ଏଇଟାରେ ବି ଦେଖିପାରିବା A ଆଉ B ଅପସନ ଯେହେତୁ ଠିକ ଅଛି ତ ଆନ୍ସର D ହିଁ ହବ। The cause of change in size and appearance of breast during pregnancy. The answer of due to the secretion of estrogen and progesterone. Estrogen and progesterone in birth control pill prevent pregnancy by estrogen and progesterone in birth control pill prevent pregnancy by pregnancy को ସେମାନେ କେମିତି prevent କରନ୍ତି? Option B ରହିବ preventing ovulation from occurring. What all are the changes occur to pituitary gland during pregnancy? Pituitary gland रे कौन कौन changes हुए? Answer होची option D increased in weight and enlarged in size, elevated growth hormone level and serum prolactin level, low level of pituitary gonadotropin. Which of the following hormone inhibit the secretion of follicle stimulating hormone? या भितर को हार्मोन हमरा इनहिबिट करंती FSH फॉर्मेशन को। Which of the following hormone inhibit secretion of FSH? या भितर को हार्मोन हमरा FSH secretion को inhibit करंती? Estrogen and inhibin B, both inhibitory factor for the secretion of FSH. A female came to the gynecologist. ଗୋଟେ female gynecologist ପାଖକୁ ଆସିଛନ୍ତି with chief complaint of irregular vaginal bleeding. ତାଙ୍କର ମୁଖ୍ୟ complaint କଣ ଅଛି ନା ତାଙ୍କର irregular vaginal bleeding ହଉଛି। The nurse knows well that the nurse କୁ ଭଲସେ ଜଣା ଅଛି ଯେ decrease in dash hormone is responsible for causing bleeding during the menstrual cycle under physiological condition. तो indirectly एठी पचारिचे को हार्मोन रा absence रे normally bleeding हुए। ठीक है। आंसर होची एस्ट्रोजेन। ता पर क्वेश्चन को जिबा gonadotropin releasing hormone stimulate the release of gonadotropin releasing hormone कौन करे stimulate करे release of follicle stimulating hormone, luteinizing hormone, growth hormone. Gonadotropin releasing hormone stimulate the release of both FSH and LH. Ovulatory function is stimulated by dash gland. Ovulatory function को gland द्वारा stimulatory हुए। तो normally pituitary gland द्वारा ovulatory function stimulate हुए। Location of Graafian follicle. Graafian follicle location कौन? Ovaries. Granulosa cells of developing ovarian follicle secretes. Ovarian follicle granulosa cell कौन secrete करे? Answer होची option C. Granulosa cells of developing ovarian follicle secrete estrogen. After ovulation ପରେ grafted follicle become grafted follicle କୋଉଟାକୁ convert ହୁଏ? Ovulation ପରେ grafted follicle convert ହୁଏ corpus luteum and ଭିତରେ ଥିବା ovary convert ହୁଏ secondary oocyte କୁ. Hormone responsible for ovulation. କୋଉ hormone ovulation ପାଇଁ responsible? FSH, LH, estrogen, progesterone. FSH ଟା ହଉଛି ଆମର follicular stimulating hormone যেটা କି grafted follicle କୁ stimulate करे. ତ FSH ଯୋଉ ଯାଏ ଅଛି ସେ ଯାଏ grafted follicle exist କରିବ. ତ ତାପରେ ଯେତେବେଳେ ଏଷ୍ଟ୍ରୋଜେନ୍ ଆସିବ ଗ୍ରାଫେନ୍ ଫଲିକଲ୍ ଇନହିବିଟ୍ ହବ ଆଉ ଗ୍ରାଫେନ୍ ଫଲିକଲଟା ମ୍ୟାଚୁର ହେଇକି ଓଭାରିକୁ ବା ସେକେଣ୍ଡାରୀ oocyteକୁ କନଭର୍ଟ ହବ. ତାହେଲେ କୋଉ ହରମୋନ୍ ରେସ୍ପନ୍ସିବଲ୍ ଫର୍ ଓଭୁଲେସନ୍? ଆନ୍ସର ହବ ଏଷ୍ଟ୍ରୋଜେନ୍. LH ହବ. ଆଚ୍ଛା FSH କମିଲେ LH ର ଭ୍ୟାଲୁ ବଢିବ. LH ର luteinizing hormone is a hormone produced by gonadotrophic cells in the anterior pituitary gland. In female, an acute rise in LH trigger ovulation and development of corpus luteum. FSH is responsible for follicular maturation. Responsible for follicular maturation. Time of ovulation corresponding to blood level of LH is high. Time of ovulation corresponds to answer which option B. Blood level of LH is high. The hormone responsible for menstrual cycle are କୋଉ ହରମୋନ୍ menstrual cycle ପାଇଁ responsible ହେଇଥାଏ? LH ovulation ପାଇଁ responsible ହେଇଥାଏ. FSH ତ ନୁହଁ, progesterone ନୁହଁ, estrogen and progesterone. କିନ୍ତୁ estrogen ଆଉ progesterone ଦି ଜଣ ଯାକ reverse direction ରେ କାମ କରନ୍ତି. progesterone corpus luteum को maintain करे. corpus luteum जो progesterone secrete करे ସେଥିରେ ovulation ଟା ଆମର maintain ହୁଏ.